Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. May is Osteoporosis Awareness Month. About 10 million Americans have the weak and brittle bones of osteoporosis, and another 44 million have low bone mass. This means half of all adults 50 and older are at risk of breaking a bone. So we're boning up on bone health, from osteoporosis prevention and new treatments to awareness that men can get osteoporosis too. Today, we're talking with Dr. Colleen Watkins, a metabolic bone diseases specialist in the WVU Medicine Department of Orthopaedics. Welcome, Dr. Watkins, to Live Healthy West Virginia.
Thanks, Mary.
It's great to have you here. I think we have a lot to talk about today.
I think we do too.
All right, so let's start with the basics. Let's start with exactly what is osteoporosis.
So osteoporosis is low bone mass or bone thinning, and that can lead to fracture. And the difficulty with osteoporosis is it's not osteoarthritis. Osteoarthritis is arthritis and bone pain, whereas osteoporosis is silent. So you don't know you have it sometimes until you have a fracture.
Oh, wow. So what would be the difference then between osteoporosis and low bone mass?
So osteoporosis and low bone mass are basically the same. When your primary care physician orders a DEXA scan, which is an x-ray that helps predict your osteoporosis sort of level, it gives you a T-score. And a T-score is kind of like the density of your bone, if it's thick or thin. If it's thin, they sometimes call it osteopenia. And then if it's really thin, they call it osteoporosis. It's similar to patients with diabetes. Sometimes your doctor will say you have pre-diabetes and you need to do these steps so you don't have diabetes. So it's similar to that.
Okay, that makes sense. Who is most likely, who is at risk to get osteoporosis?
The biggest patient group at risk are those that are 65 and older, especially women, but men get osteoporosis too. There are lots of risks though. If you have multiple risks and you're younger, so over the age of 50, then you should be screened. And risks are things like women that have early hysterectomies that have had their ovaries out, patients with diabetes, smokers, those with a family history. And then there are certain medications. Prednisone is notorious to cause low bone mass or bone thinning. Patients on chronic prednisone, not prednisone that you take for poison ivy or for bronchitis for a couple of days, but being on prednisone for 3 months, 4 months, years at a time. There are also common heartburn medications. You might know those as Prilosec, Prevacid, Nexium. Those over time, 5 years, 10 years, can cause your vitamin D to be low. If your vitamin D is low, that's a building block for your bones, and your bones can be thinner.
Oh, wow. So there's a lot of things that can contribute to that.
Yes.
What are the symptoms? I mean, do you usually have, because we were talking earlier and you
Right.
called this a silent.
Right. It's silent, so you don't have symptoms. Sometimes the first symptom is you're walking in Walmart, you slip and fall, and your hip breaks. And then you're brought to the hospital, and the surgeons or the emergency department physicians note on your x-ray that it looks thin after your fracture. So there aren't really symptoms of osteoporosis, and that's why a lot of patients don't even know they have it.
But if you have some of the risk factors, you mentioned that we should get screened earlier.
Right.
So when should we get by screening, you mean a DEXA scan?
Correct.
Okay. So if we have risk factors, when should we get the DEXA scan at a younger age? If we don't have risk factors, should we get a DEXA scan?
Right. So typically women, after they go through menopause, the doctor will wait about 2 to 4 years to get you your first DEXA. But if you're at age 65, whether you're a man or a woman, you can get a DEXA without risk factors. But if you have multiple risk factors, diabetes, smoking, family history, or you've already had a low trauma fracture, you fell in your house, you slipped outside gardening, you should probably get a DEXA.
Okay.
And it's an easy test. It's just an x-ray. You're not put in a tube like when you have a CAT scan or an MRI. There's no dye involved. It's just a simple x-ray that they usually take of your back and your hips, and then that produces the T-score, which is basically the thickness of your bones.
And that's it.
That's it. It's very ezy.
It's not claustrophobic.
No. You don't have to worry if you're claustrophobic. You can easily have this.
That's good to know.
Yes.
So how exactly is then osteoporosis diagnosed?
So it's diagnosed by the T-score, and once you have the T-score, it'll give certain scores. So if it's negative, and they're in the negative, so it's a little bit confusing, but if your score's -1 to -2.4, you're considered osteopenia. But then you take that score, and you can easily even do this at home. Most people use Google and they use the computer. There's something called a FRAX, F-R-A-X score.
Yeah.
And you put in your height, and your weight, and your risks, and then you put in your T-score, and it spits out these numbers basically and tells you how at risk you are over the next 10 years of breaking a bone. But if you have osteoporosis by your T-score, which is -2.5, we automatically consider doing prescription treatment. The other treatments, though, it's not all prescriptions. So the biggest way you treat osteoporosis or pre-osteoporosis, osteopenia, is don't fall. So you kind of know the risk already. If you sit down and think about it, throw rugs, slippery surfaces like in your bathroom. We all try to clean our bathroom with, fancy cleaner. Those cleaners can be very slippery after you clean them. Going up and down your stairs. In the winter, we're all doomed here with the winters.
Yes,
icy
we are.
surfaces, wet surfaces. A lot of patients like to garden. We live in West Virginia. The hills, you're gardening on the side of a hill after it rains, windstorms. There's lots of things that can cause you to fall.
Yeah.
And then if you think about your home, if I would blindfold you, you could walk around your home.
Yes.
If I take you into my home and I blindfold you,
that's not good.
You can't walk around your home.
No.
So when you're at somebody else's home or you're at a restaurant, your feet don't automatically know where the little lips are.
Yes.
Where your tile meets your rug, and you could easily fall. So that's the first part of treatment.
Okay.
Then the second part, if you have osteopenia or osteoporosis, is your doctor will check your vitamin D level and your calcium level. And if they're low, you can take some over-the-counter supplements, which you can buy anywhere, and they're very inexpensive.
Yeah.
And then the last part would be consideration of medications. Most primary care physicians can prescribe these medications. If you need a more sophisticated medication, that's when patients are generally referred to us, and then we start more sophisticated medications, which luckily don't usually have a lot of side effects or problems.
What typical type of medications would you be prescribed, when you after you've done everything else?
Sure. If you've already done the fall prevention and taking the vitamins, the first line treatment are generally medications you may have heard about, like Fosamax and Actonel. Those are pills that people take once a week, generally. If they cause problems, then we have other medications. We have IVs that are administered once a year. We have shots that are administered twice a year. And then we have other more sophisticated sort of bone builders for extreme cases, which can be shots every day, shots once a month. So we have a lot of different options. It's not a one size fits all. It kind of is following sort of a cookbook, but just like in cooking, there are caveats to what you do at different times for different people.
Yeah. So is there, much difference if you're diagnosed with osteopenia as opposed to osteoporosis would you follow those same things you just described of, avoiding falling, is it the same basically?
It's basically the same, except for in severe cases. If the numbers are really low, then you would start with a more sophisticated medication. Or if the patient has already broken a hip or has a vertebral fracture or broken their wrists, or if they fall a lot. So there are patients with Parkinson's disease, there are patients with neuropathy, there are patients that have a high risk of falls, and eventually they're going to fall and break something. A lot of times it's a gut feeling. So we work closely with the geriatricians and the neurologists to assess the patients with high falls, and then you probably treat those on a more consistent basis than you would with someone that doesn't fall all the time.
Okay. Is there a cure for osteoporosis?
There's no cure. We do have very good medications. We can definitely stabilize the bone density scores and decrease the risk of fracture, but we can't reverse the numbers. It's sort of like your gray hair, once you get gray hair, you can color it, but you can't eliminate totally your gray hair.
And you can't gain back bone mass that you've lost?
You can gain back some with some of the medications.
Okay.
It does get better, but it won't go back to normal.
It won't be
like
full.
when you're 20.
Yeah.
Right.
I like that
Like
hair
a lot of
hair
other
color
things.
analogy.
That's right.
So are there any new exciting treatments on the horizon that, we're doing trials on or anything?
The newest treatment we have that we use is a once-a-month medication, and that's been out for a couple of years. But the newest, not really a treatment, but we started in January of last year in 2024.
Mm-hmm.
We're screening the patients that get joint replacement. So those that come to WVU Medicine that are going to get a knee replacement or a hip replacement or spine surgery, if you're over the age of 65, we automatically get a DEXA. The analogy I like to use is very simple. If you take a stick of butter and you put a nail in it and you try to hang a picture off of that stick of butter, it's going to fall.
Right.
But if you make that butter like wood and you put a nail in it and you hang a picture, it's going to stay. So the surgeons would rather put your joint replacement in wood and not in butter. And then our doctors and our pre-optimization team, they also look at patients between the ages of 50 and 64 if they have those same risks. Diabetes, smoking, family history, they get a DEXA. And if their bone density is low, they're either treated as part of the pre-optimization or they're sent to us for treatment even before joint replacement or spine surgery. So that's the newest and most exciting thing that we're doing now.
So a lot of it's prevention.
A lot of it's prevention, and then your joint replacement will last longer.
Wow, that's good to know too.
Yes.
Well, is there anything? Well, I know you've talked about a lot of this stuff, but what should we be doing right now to prevent osteoporosis, whether we feel we're at risk or not?
Right. Even if you don't feel that you're at risk, I mean, most women, if we live long enough, will be at risk at some point. It's the things you hear already. Eat healthy, be healthy, don't smoke or reduce your smoking if you can. Talk to your doctor about it. And then exercise. While exercise, weightlifting, those sort of things, if you like it, that's fine, you can do it, but it's not necessarily going to make your bones thicker. All exercise will make it less likely that you fall, and that's the whole point. If you fall, you're probably going to break a bone. If you don't fall, you're probably not, regardless of if you're on a medication. So exercise programs that are very good, Tai Chi, Pilates, even sitting Pilates that you see on Facebook, you see on Google.
Mm-hmm.
There's lots of different things like that. Yoga is very good. Things for balance. We always talk about, we need to sit up straight, stand up straight. Your mom told you to stand up straight. Well, that's true. Those are core exercises. Keep you standing up straight, keep your balance. Yeah. Just like with Parkinson's patients that go to boxing class, which is very good. It's very good for their mobility and it's very good for fall prevention.
I didn't realize that was recommended for Parkinson's patients.
Yes.
That's interesting.
They have lots of programs around here. They have programs in Fairmont. They have programs in Morgantown.
Oh, wow. Okay. So what's the best way to build bone strength?
The best way to build bone strength when you're young is to not smoke and to get adequate calcium and vitamin D and to maintain a healthy weight. So when you're young, it's a little bit easier. And then that's where the weight-bearing exercises would work more. As you get older and you lose estrogen as a woman or you lose testosterone as a man, you can't really build up your bones that well, but you can prevent them from getting worse by, again, not smoking, eating healthy, doing exercise. But that's where the balance exercises come into play. But really, it's very difficult to reverse father time, so to speak.
Right.
But you can maintain your bone density in a healthy way.
And if you want to keep moving, you've got to keep moving.
Keep moving, that's right.
Yeah.
Usually patients will say, when I sit for too long, I hurt or I don't feel good. While you can't feel osteoporosis, your bones also don't feel good and get thinner by immobility.
Okay. Another good thing. But you're just full of good things to know.
So.
This is great. Can you talk a little bit about the depth of experience of the team at the WVU Medicine Orthopaedics department, not only in treating osteoporosis, but other bone conditions?
So there's a group through the American Orthopaedic Association called Own the Bone, of which we're a star performer. Well, years ago, Own the Bone recognized orthopedic surgeons were seeing a patient for example, a right hip fracture. They would repair it, the patient would recover. Then they'd see him 2 years later with a left hip fracture. Well, that's very frustrating as a surgeon. You treat somebody and you assume that they're going to then get a DEXA, be placed on medication, somebody's going to talk to them about fall prevention. Well, that didn't happen. So I was approached through the Department of Orthopaedics to create a program to prevent the second fracture. So that's what we do. We see all the patients that come into the hospital with fracture over the age of 65, and we see those between 50 and 64 with risks. So it's the same theme over and over again. We want to prevent the second fracture. Fall prevention, calcium and vitamin D, and medications if indicated. Then what we expanded to is we want to prevent the first fracture. So we don't want it to happen at all. So our primary care physicians around the state have been doing a fabulous job. We started this about 15 years ago. About the 10-year mark, we started to see an influx of patients, more and more patients getting DEXAs, more and more DEXAs being available in West Virginia, although we would, of course, like more and we'd like to expand. But we're now preventing the first fractures, which is the whole point.
Oh, yeah.
You don't want to have a fracture to begin with.
Yeah. Anytime we can get the trajectory going in the right direction, because we're number one in enough
we don't
bad things. No,
definitely not.
No. That's interesting. So before we go, what would you say is the most important thing you want our viewers or listeners to know about osteoporosis?
Definitely speak to your primary care physician about getting a DEXA. It's a simple test. It's a simple interpretation. Patients can even look up the interpretation themselves and be armed with information to talk to their primary care physician. And then if it's a complicated situation, we're more than happy to help. The second thing is fall prevention. I talk to my patients all the time about fall prevention, putting your hand on the handrail when you're going up and down the stairs. I find myself then trying to carry in a bunch of groceries and my hand's not on the handrail, and I think, I talk to people about this all the time, stop doing it. Or you're gardening and you want to get that one more patch of weeds pulled, but you're exhausted and you're dehydrated. Don't do it. Leave it for another day. Fall prevention and getting your DEXA scan are the two most important things.
All right, great to know. Well, thank you so much for sharing
You're
all
welcome.
this information with us. Hopefully we'll be preventing more first and second fractures,
Correct.
Which would be awesome.
Thank you.
Right. Well, thank you. Well, that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information about osteoporosis and orthopedics, visit wvumedicine.org/ortho. And to find the latest episode and all episodes of Live Healthy West Virginia, visit wvmetronews.com/podcast or the new Metro News TV app. I'm Mary Ravazio Menard, and on behalf of Dr. Watkins and everyone at WVU Medicine, thanks for joining us.